Quickie on pain, which is not perhaps as simple as we sometimes think. If you find the back of your hand, everyone I'm sure watching will have had an injection or blood taken, and just pinch your skin hard enough that it's about the same amount, might be better right there, about the same amount of pain as you would get from an injection. Okay? Everyone done that? Splendid. Now, consider the amount of anxiety that caused you, consider the amount of distress that caused you, consider the amount of sort of the emotional aspects of pain that caused you. Probably not a great deal. Now imagine that you are at a clinic and I've just taken out a nice clean sterile needle. I've swapped the back of your hand or your arm or whichever bit you pinched, and I'm about to sort of slide that needle on in under your skin. Consider the amount of discomfort, pain, fear, the unpleasant aspects of pain that you would experience then. It's probably not the same. It's not a zero sum, and that's because pain is a little bit more complex than merely the sensation that we feel. Pain is an emotional response. It's an output of the brain rather than an input. And this is very relevant when we talk about how our patients are, what conditions our patients have. If you say to a patient that the pain that they are getting in their big toe joint is because the joint is a little worn, joints tend to get a bit achy when they get a bit worn, that will give them one idea. If you tell them that they have a chronic degenerative joint disease and they are developing bone-on-bone contact, the cartilage is wearing away within that joint, same amount of pain, but you've just recontextualized that whole business for them. Something to think about when we describe conditions to patients. We have to be very careful not to make their pain worse by scaring them.